Not on Your Side is looking at where we are 1 year into the pandemic and how COVID is still changing aspects of everyday life.
Medical workers are still dealing with the effects of the pandemic. They've spent a year caring for the virus victims, often being their only human contact.
Not on Your Side's Camila Barco takes us inside the COVID unit at Carolina East to see what it looks like now.
Only the sickest COVID patients are on this floor or in the intensive care unit. Hundreds of people have been hospitalized in these rooms. Doctors and nurses say the worst of the pandemic is over, but the scars will last forever.
Carolina East doctor Sunil Kumta gears up every day to help patients fight the coronavirus.
It's been tough, but it's been, rewarding to see the patients that we can help and that, get out of the hospital.
A year ago, there were more questions about COVID than answers.
So I was definitely a little nervous because obviously I didn't know what we were all getting ourselves into.
Fast forward to March 2021. COVID vaccinations are rolling out, virus testing has evolved, and doctors are more confident in their treatments.
There's still a lot of things that make us nervous, but we're getting more comfortable.
Gina Hudgens is a registered nurse at Carolina East. The memory of her first COVID patient is still fresh in her mind.
And I remember my heart beating so fast. I came into work and didn't realize that I would be working on the COVID unit.
In 12 months, nurses and doctors have been strained to their limits, but Hudgens is less fearful now. She says it's much easier to keep people safe.
We know what signs and symptoms to look for.
Hudgens says there's no more guessing games. The hospital is better armed to fight this virus.
They know what supplies to order.
Family members are restricted from entering this area of the hospital. It's still troubling for Kumta.
Hey, sir. Morning.
He's sometimes the last person dying patients in the hospital can physically see and touch.
And you end up being like their family, and then, having them pass away in the hospital with nobody except hospital staff, that sometimes can be real tough.
The pandemic also changed nurses and doctors' lives away from the hospital. The virus denied them contact with people they love.
Go home, straight home, and change at the back door and run straight to the shower and not even let them get close to me or touch me.
Hudgens prefers to look at the present and the future.
I already think things are starting to get better.
Kumta believes the added protective layers he now wears may be permanent.
Well, we may always have a COVID unit to some capacity.
But he hopes the virus will be the least of their worries soon enough.
We just gotta pray and hope that it'll go away.
The chaos of the start of the pandemic is no more. These caregivers now follow policies and guidelines learned from a year of uncertainty and turmoil. They're still used on a couple of floors dedicated to treating the hospital's most vulnerable COVID patients. At Carolina East Medical Center, Camila Barco, Not on Your Side.
And don't forget, every one of our specials for the State of series has its own podcasts. Our Camila Barco explains what she learned and goes in depth of how hospitals have been impacted in Eastern North Carolina. Listen to the episode now at WNCT.com under the Features tab on the WNCT Podcast Network, Spotify, iTunes, or wherever you get your favorite podcasts.